properly if we do not have appropriate nutrition.
If certain lab values are off, like your percentage organ is not.
Yep, certain lab values. Do you remember a specific lab value?
Sodium,
Okay, sodium,
calcium.
which we'll talk a little bit more about today. But what was that one lab that was below, what was it? Told us that we were malnourished? Below 11.
Oh, is it, your iron, red blood cell? Below 11. Triglyceride?
Nope.
Below, what's below? What letter does it start with? Phosphorus.
Huh?
Phosphorus?
No.
Very good.
Yep,
We talked about it?
we did. I was like, was it on the slide? But it is indeed on the slide.
Is it pH?
No.
Right. Right.
Prealbumin, we got it.
Oh my goodness.
Prealbumin below 11 indicates That's funny. We have a bunch of different vitamins and minerals. We have vitamins A. What does vitamin A help us with?
Eyesight.
Eyesight, especially at night, right? Yeah. Helps increase resistance to infection. Where do we get vitamin A from?
Carrots.
Okay. Did I hear egg yolk? If you said what you said, then yes. Dark leafy green vegetables. What about vitamin D? What is this also known as? The sunshine vitamin, yep. Synthesizes in the skin when exposed to sunlight. Helps with bone and tissue formation. Vitamin E. What's it good for?
Cell injury.
Yep, cell injury, helps with the immune system. Vitamin K. Yep. It helps promote clotting or coagulation. Where is it synthesized?
Your gut.
In the bacteria found in the large intestine, good. So bruising and bleeding can be signs that my vitamin D levels are low. Yep. Again, found in dark green leafy vegetables. We had a ton of vitamin Bs. Which ones are the most common that we talk about? B12, B2, B7, B9, I mean, kind of, most of them we talk about. B12 is essential to help produce red blood cells. B1 is thiamine, that helps metabolize protein, fat, and carbohydrates. Helps promote normal heart, muscle, and nervous system function. B9 is also known as what? Folic acid. Who is that super important for? Pregnant women, yep, for the babies. The MyPlate, we had all seen the MyPlate and heard about the MyPlate, but is that good for everyone?
No.
Why?
Certain limitations of
There might be some patients that are on certain diets that if that's not gonna benefit from. There might be patients that need extra protein to help them heal or whatever they need. The MyPlate is not gonna be beneficial for everyone. It's a good guideline, to have a healthy diet, but again, you gotta remember it's not used for everyone. What does culture, ethnicity, and religion have to do with, nutrition? Say say that again.
Food prep?
How they prep their food, yeah.
Dietary restrictions.
What restrictions, what are you gonna say? What they eat in general, what they can't eat, yep. What did dysphagia mean? Difficulty swallowing, yep. We talked about this with rickets, what is that a deficiency in? Vitamin D, and then scurvy? Vitamin C deficiency, yep. What's anemia? Low red blood cells. We have the petechiae. Yep. Sometimes, like that. What was the difference between type 1 and type 2 diabetes? Does that mean that type 2 doesn't need insulin? They might need it to help lower their blood sugar, but it's not as dependent as type 1 is, okay? When do we normally see type 1 develop? In childhood. Yeah, what about, type 2? Adulthood, yeah, yep. What is a food allergy?
The intolerance.
Your body's against things.
Kind of fight against it. What are the common food allergies that we see? What did you say?
Dairy, eggs, and treatment.
Dairy, eggs, and tree nuts, yeah, absolutely. Sometimes wheat, and then our intolerance is what? It upsets your stomach, so like lactose intolerant, sometimes gluten, yep. BMI, we know that there are different levels. BMI of 30 or higher is what? What about a BMI of 40 or higher? Morbid obesity. What if you have one at 26?
Or no, it's overweight.
It's overweight. Between 25 and 29.9 is considered to be overweight. So you guys, like I said, will need to know those ranges to make sure that you are looking at those. I see them ask questions about that every time. So when we, I'm sorry, 25, between 25 and 29.9, that is considered to be overweight. Sometimes when we think of malnutrition, we automatically go to someone that is emaciated and, doesn't have a lot of fat. But we also have the opposite end, where someone could be very overweight and still be considered to be malnourished, right? Why?
If they're not getting nutrients or they're getting excessive amount of it.
Yes, yeah. What is anorexia nervosa?
The illness when you're severely skinny and not eating.
What kind of,
Lack of calorie intake.
okay, very restrictive in their calorie intake, yep. What else would we see?
Excessive exercise, excessive behaviors.
Yes.
Lack
Yes.
of appetite.
Or they might not wanna eat in front of their family or friends. What about bulimia nervosa?
Binging and purging.
Binging and purging, yep. What else could we see that would let us know that that patient is struggling with that? Their teeth are going to kind of be, corroded. Why?
Yes.
Yes. What else could they both abuse? What makes them, what helps them lose weight? Huh? Laxatives or, laxatives and sometimes diuretics to help get rid of the extra fluid. Good. What kind of signs of malnutrition could we see? Like visual cues could we see? Pale skin, yeah,
Hair.
or hair. Their hair almost looks pale. Yeah. Could see bones protruding sometimes, yeah. Huh?
Hair loss?
Hair loss. Do you think the elasticity of their skin is gonna be normal?
No.
Their dentition, their oral care is probably not gonna be good. But if you think about patients with missing teeth or cracked teeth, do you think they're at risk for malnutrition? Why? Because they can't eat, it's painful. What about patients that were just placed on a dysphagia diet? Do you think, or like, even more so a pureed diet? If all of their eating is pureed foods, do you think that they're at risk for being malnourished?
Yes.
100%. Yeah. What was pernicious anemia?
Really good iron?
So the beefy red tongue.
It is the beefy red tongue, yep. So if we have patients that have that, their tongue is very inflamed, it's gonna be sore, and they're not gonna be able to eat. Good. Which population is more at risk for foodborne illnesses?
Older people?
Older people, why? Because they're not gonna be able to feel the temperature, they might not be able to see or smell as well. So we always want to teach them to use a what? A food thermometer, absolutely. Who decides what kind of diet your patient's gonna be on? Dietitian,
And the
speech
speech
therapy. Can I just decide, oh, they're fine, I'm gonna give them a regular diet?
No.
No. What could that, lead to? Absolutely, yes. For sure.
Aspiration.
Aspiration, yep. So whenever I am providing food or nutrition to my patient, how do I want them positioned, sitting up? I would actually prefer them to be out of bed, but if they can't get out of bed, I want them up as high as they can. And up and as far as the bed as they can. So prealbumin less than 11, that shows malnutrition. What about our hemoglobin and hematocrit laboratory values? What does that tell us?
The blood flow, oxygen.
What the oxygen, and the percentage of circulating erythrocytes, and their ability to provide oxygen to the different cells. Good.
The hemoglobin or what?
Hematocrit,
What did it, before that?
prealbumin.
Yeah,
Prealbumin was on slide 24. With the laboratory studies and elimination pattern, so that
Below 11.
below 11 indicates the presence of malnutrition. What kind of test would we see for kidney function? Yep, BUN and creatinine, that's gonna show our kidney function. What's the difference between constipation and diarrhea? Yep. 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 Did you guys talk about, no, we'll come up with, never mind, that's later. Vegetarian, what kind of diet is that? No, does not eat meat. Lacto-ovo. Yep, they can eat milk and eggs. What about pesco, like pescatarian? Fish. And then vegan. No animal products, yeah. So we talked about this, but do you think those that are on those specific diets are more at risk for malnutrition? Yeah. What's clear liquid diet? See-through, like black coffee, popsicles, Jell-O, broth. What about full liquids? Horrible. What was it? liquid at room temperature, something that's pourable, so like our protein drinks. If you don't have, something like a protein drink, you can get like chocolate pudding and mix milk with it to make it pourable. Make a milkshake, my favorite thing, especially with your elderly patients, they love their sweet treats. Get your little chocolate protein drink with some ice cream and mix it up real good, they got a chocolate shake, but then get extra protein at the same time.
They have that protein ice cream now too, right?
Oh, yes, they do, I forgot about that.
My daughter ate that stuff up in the hospital.
Yes, yes, I forgot about those. I don't see those as frequently in the hospitals.
Do they have that at Walmart?
Yeah, long-term care for sure.
What?
Do they have that at Walmart?
They don't have the Thrive brand, I don't think, we looked at ordering it, cause it was all my daughter would eat, but they have lots of other brands now. It's
They have
really-
what?
They, the Thrive brand is what they had at Shriners, and my daughter only ate that, so we were trying to figure out how to get it at our house, but, we